So Alice, now I also want to talk about different therapeutic strategies in MS. And as you very well know, in the German guidelines, we have these kind of 3 boxes. One box, sometimes we are referring to this one as platform therapies, defined as a treatment for mild and moderate active MS, while we have this high active MS therapies and something in between.
Yeah.
So for the moment, I would like to focus on the platform therapies. What can you tell us about the ideal patients for these kind of therapies?
So these are the patients that have a milder MS, so to speak. So primarily, if there are a few lesions in the brain itself, not in the cerebellum, that's, we call them infratentorial lesions. That means you have the main cortex of the brain, and then it sits on the smaller coordination center called the cerebellum, and then you've got your spinal cord. And lesions in the cerebellum or in the spinal cord get up to more mischief, so to speak, than lesions in the brain itself. So you always say if you have 9 lesions in the brain, maybe one of them will make symptoms. If you have 9 lesions infratentorially, that means in the cerebellum or in the spinal cord, you're going to have more symptoms than you would in the brain. And so generally, when patients develop lesions in these areas infratentorially, we say, let's try a more effective therapy, because we don't have much tissue there to play with. We need to be a bit more serious in that regard with the prognosis. So that would be then patients who have a few lesions in the brain itself, who are not particularly troubled by their MS. They come and say, I don't really have any symptoms at all in my daily life, and then would say, okay, these are the options. We would probably not need to escalate to a highly effective therapy for you at this moment in time. And we'd talk about then the platform therapies, because they are associated with less severe side effects, and it's always a balance of side effects and treatment. You need to make sure you're giving a treatment that's good enough for that patient in that moment in time, and that's not too extreme on the side effect profile where it's not warranted due to that picture of the MS at that moment.
But when we talk about platform therapies, we have to talk about the injectables on the one side, like the beta interferons or the glatiramer acetate. And there we have side effects like flu-like symptoms for the interferons, or lipodystrophy, or a flush with the GA. On the other hand, with the oral options like teriflunomide or DMF, dimethyl fumarate, we can talk about gastrointestinal side effects, flushing, or hair thinning, for instance, some like polyneuropathy-like side effects. So they are there, but how can we discuss this with the patients?
So I just did a classic doctor thing where you say, oh, no side effects. We mean no side effects that really make a doctor nervous. So some of the side effects of the higher therapy, of the highly effective therapies, can in some constellations be, critical. Of course, if you're a CEO of a big company and you have MS and you don't really want everyone to know about it, so you don't need to declare that to the world, and then you've taken a therapy that is causing a side effect like flushing, for example, and you're sitting in a meeting with your investors and you're going bright red when you're actually feeling quite relaxed, that's a severe side effect for you in that moment that affects your life. And although as a doctor I could say, well, it's harmless, actually for that patient it is quite harmful. So it's a really important individualized decision to make. If you're scared of needles, then you're going to go for the oral therapy. There are obvious things like that, but you do need to ask, what job do you have? Are you traveling a lot? And work out, which therapies would be best suited to that lifestyle. So that's definitely an important part of making that decision, so that you're clear that that treatment is going to be as minimally destructive as possible for that patient's life.
But from my point of view, this is a huge development in neuroimmunology, because when I started my career in neurology, treatment options were still limited. So there was not much of what side effects compared to what treatment effect can we recommend. And I think this is now a time where we can at least speak a little bit in the direction of individualized therapies and individualized treatment strategies, which is, I think, a success story in neuroimmunology.
Absolutely. I mean, my dad's a neurologist too, also my granddad. And my dad, I talked to him about how I'm interested in MS and how we do a lot of MS research, and he'd say, on the wards 40 years ago, you'd walk onto the ward and the patients with MS would be bedbound because we did not have the treatments that we have nowadays. And it's an absolute success story of science, MS as a field, that patients can be offered such fantastic therapies that you hear at some conferences people, saying, oh, well, we're going in the direction of a cure. And in such a short generational time span, my father and me, we have two different worlds for MS, and that's all thanks to research and thanks to patients who take part in clinical trials. So yeah, it's a great time to be an MS specialist.